Today we will be looking at common instruments used in skin cancer surgery. First of all, starting with the scalpel, the number 15 scalpel is most commonly used for excisions. We tend to use a disposable blade, which is cheap and easy to use. In areas where there may need to be fine excisions, such as on the eyelids, or when making small incisions, we may opt for a number 11 blade, which may be more easy to manoeuvre in confined excisions. Needle holders are very important. In this case, we have flat needle holders, which are reasonably small. These are good to pick up and use needles of varying sizes, and also to pick up and use suture threads of varying sizes and types. Using a pair of longer needle holders can give you more leverage and make the procedure easier. Here we have large needle holders with a serrated face. This is good for picking up needles of most sizes. One drawback of these needle holders, however, is that the surface here may slip when pulling on fine threads, or when pulling firmly on braided material may cut it. Needle holders are very important. There are many different types of needle holders, and it is through a process of experimentation that you find the needle holder most suitable for your needs and most suitable for the procedure and the suture that is being used. Here we have a pair of Olsen Hagars. These are needle holders as normal. They have a tungsten carbide insert at the gripping face, and this means that the gripping surface is very accurate. These are good for holding onto any size needle, particularly small needles, and they have a good grip on suture material, particularly thin suture material. The gold handles signify that it does have a tungsten carbide insert, and of course this means the suture holders will be much more expensive. Being Olsen Hagars, they have a scissor incorporated in the instrument, so that when the suture is completed, the scissors may be used to trim the suture. Tissue forceps are also very important. Here we have a pair of Olsen tissue forceps. They have 3 teeth on the very tip, and the teeth allow secure grabbing of the skin or tissue without damage. For delicate areas such as the eyelids or with very small excisions, we have some Bishop Harmon's forceps, which are similar to the Olsen forceps. They also have 3 tiny teeth at the tip. The only difference being is that they are very small and perfect for, as we said, something like eyelid skin. With scissors, which we use to trim suture material, but also to dissect the skin, we like smaller iris scissors. Again, the gold handle indicates that there are tungsten carbide inserts, which in scissors is a very good idea because the scissors need to be sharp. The tungsten carbide is very hard and means that the scissors will retain their sharpness for a lot longer without needing sharpening, ensuring that you always have sharp scissors. We liked the curved scissors as when dissecting, basically everything we dissect is curved. So this is helpful if cutting through skin or removing fat from a graft to prepare it, or with dissection. Similarly, we have some curved iris scissors. These are blunt nosed, and we use these when doing procedures on the eyelids. The blunt nose is just an added precaution in case there is some mishap. We do not want to go damaging the eyeball with sharp tips. Here we have Mayo Scissors. Again, the gold handle signifies the tungsten carbide insert. We primarily use these to shape a graft which may be too thick to shape with normal iris scissors. We need large scissors to shape a graft so that they cut cleanly through the thicker skin and do not damage the skin. Mosquito forceps are mainly used to clamp down on blood vessels which have been transected and are bleeding. The blood vessels can then be sutured and the mosquito forceps removed. Mosquito forceps are also used to hold onto the tip of skin when we are dissecting a skin graft. Here is a skin hook which is commonly used when performing flap procedures. The small hook on the end will help grab the flap and pull it into position without damaging the tissue or crushing it. Similar to a skin hook, we have a rake, which is basically two skin hooks in a line. These two instruments can basically be used interchangeably, depending on your preference. When performing quartering curettage, this is a curette, which is a blunt instrument, and this works on the fact that skin cancer is fragile or friable, and so when curetting the tissue, force can be applied to curette the cancerous tissue, and then when you come down to normal skin, because of the blunt nature of the instrument, we will find that tissue is no longer being removed. When performing procedures on the scalp, it is very handy to have a scalp clamp available. This works by inserting the pliers into the clamp and opening the clamp up. The clamp is applied to the skin edge and released to give temporary hemostasis. When ready, the pliers are placed back in the clamp is opened and this is removed from the scalp, and sutures may be placed into the bleeding vessel to stop the bleeding.
I hope this video has been helpful. If so, please feel free to leave a comment. Thank you for watching.
If you found this video helpful, or if there's an area you'd like covered, then please leave a comment. Thank you.